Hello everyone, welcome back to Medical Coding Club. This is Chandrika, and today we will be discussing few more ENM related questions, and I'll try to explain few and I will leave few questions for your practice. So let's begin. And also, I'm very happy to share that I have received another international provider education opportunity, and I'll be taking session soon. And for this platform, the webinar charges they're charging for around $250, and since it's from USA, they'll be charging likewise. And the other speakers that I got to meet on this platform are having so much of experience, like 30 years of experience, 25 and above, and like to have connection with those professional, well experienced professional feels really it means a lot to me. And also to get to reach to this level, it was not an easy thing. I had worked so hard, and wherever I was working, I proved myself that I am good at work. And also I took classes, and in teaching also I proved that I'm good at teaching as well. And like it's not easy. If you are in my place, you might have understood this feeling, but it's okay. Yeah, let me move with my ENM quiz. So here is my first question. So I'll try to explain. And before that, I would feel really demotivated to create content or to create educational videos related to CPC these days, because the CPC paper is getting circulated like anything. Okay, so many people are selling the paper itself and not teaching anything. So eventually, if it continues, the certification will lose its integrity, and the amount of value that employer is giving for CPC, it will eventually it will be like it will be lost, as I can say, it will be lost. So whoever doing that thing, please try to teach the students first, and then if you feel like there is a necessity, then you can share some important question, but do not just hand over the paper itself. So it's there is a so much, when we speak about the USA perspective, they're giving so much importance to certifications. They will handle everything with the secured. I mean, they will not let anyone to reveal single question also. But here in India, it is way too worst nowadays. I don't know when people will understand the severity of what they are doing. So it is all against the AAPC ethic rules. I just, if you know more, you will be quiet. Okay, if you are not aware, you will be doing such things. So we can't help. And yeah, coming to the question, so here, established patient, office visit, as they have given, it's an office visit, and the patient is established patient. The patient is a 72-year-old female seen today for follow up on a chronic condition, and she has a severe rheumatoid arthritis and hypothyroidism, hypertension, and she had a right lobectomy secondary to lung cancer. Okay, and then comes to objective. Under objective, you can see that they have reviewed the chart, indicated that last visit did check a TSI which was slightly elevated at 5.9, and patient has been on the same dose of synthroid for many years. So this slightly elevated, you can take it as exacerbation. Okay, and also they have changed the dosage of the current medication. This you can take it as a management. Okay, prescription management. And coming to the data points here, so we have TSH, labs ordered CBC and CMP and TSH. So three unique tests ordered. Okay, so though they are penal, you cannot take it as a multiple test. So CBC will be one unique test, CMP will be one unique test, same way TSH will be one unique test. So three data points you got here, and this is your final assessment. Patient is having hypertension, arthritis and hypothyroidism. And lastly, plan refill their medication and adjusting a higher dosage of synthroid. Okay, so adjusting to higher dosage means here the condition is getting worsening, that's why they are increasing the dosage of the drug. Okay, so that is the part of management. And then they have recommended to have a follow up in 3 months. Okay, so this is a question. So as you know, to find the MDM final MDM level, you need 3 points or the 3 elements. First one will be problem addressed, second one will be data point, and last one will be risk. Okay, so we will see with the table. So you can see here chart A, chart B, and chart C. So to get the final MDM, you need any two charts that are meet or exceed, and you can drop the lowest one. Okay. So now let's come from the problem. So the patient had a chronic problems. Okay. So patient had 3 chronic problem, but those chronic problems were not stable. Okay. The conditions were getting worsening, so that you need to take here 1 plus chronic illness with exacerbation. Okay, so the problem point will become moderate level. Problem will be moderate. Next, data, if you look into data points, data we had 3 unique test ordered: CBC, CMP, and TSH. So here coming to moderate level, 1 out of 3 category, we are meeting the first category, which are test and document. Okay, 3 like labs ordered, so 3 points. That means I am getting my data level as moderate. Okay, and again coming to risk, here I have prescription drug management, but it was a refill. Okay, synthroid was a current medication, now they have adjusted the medication. So that comes to here in this point, prescription drug management, new prescription or refill with management. So since the with management documentation, with management means either they should increase the dosage or they should decrease the dosage. Okay, so if they are not talking anything about the management, about the refill, then it comes refill without documentation of management. So as of now in our question, there was a documentation for management. They were specifying they increase the dosage. So I will take this point, refill with management. Okay, my risk will also become moderate. So my final MDM, since all the 3 points, or if you consider 2 elements also meeting as moderate, so my final MDM will become moderate. Okay, so the ENM level I'll be getting 99214. Office visit, patient was established, so I will be getting answer as 99214. Okay, so these charts are important. So like everything I have explained in my past videos about chart A completely and chart B and chart C, everything. So once you can check if you have not watched those videos. Okay, so I will leave few questions for yourself for practice, and I will also add the rationale. So please pause the screen and refer the rationale, which will be giving you more information. Okay, so thank you all, thank you for watching, and watch till end also.